Hi there. My name is Katie Taylor with Taylor Physical Therapy and Wellness. I'm coming to you today in the first of 3-part series about lymphedema, what that condition is, how we go about diagnosing that condition, treating that condition, and ultimately managing that condition. So many of you wrote back that you knew someone that had lymphedema, all the way to, nope, never heard of it. I have no idea what that is and who that affects. So I'm excited to share that information with you all today. Lymphedema, by definition, is an abnormal accumulation of a protein-rich fluid or lymph somewhere in the body. And so who is affected by this? Anyone that has had lymph node removal, radiation therapy, or what's called basically an exploratory surgery that involves the lymph nodes are at risk for developing lymphedema. 100% of patients that fit those kind of categories are at risk of developing this condition. So specifically what we see often are women that have had breast cancer. So when a woman is diagnosed with breast cancer, if she and her oncology team deem that radiation therapy is necessary as part of her treatment, that places that woman or man at risk of developing lymphedema. If they do what is called an axillary lymph node dissection, which is a commonly done surgical procedure, that also places someone at higher risk of developing lymphedema. And so this is something that often symptoms will not present until much later. Research shows that 49% of women will not show symptoms of swelling or of hardening of the skin or anything like that until much later, even years later, after their diagnosis, their treatment, and so forth has been completed. Women can still show symptoms and start to have symptoms months and even I've seen years down the road. So that is what lymphedema is. It's essentially, again, a condition that fluid accumulates in a part of the body. We'll use breast cancer as an example. We have a cluster of lymph nodes in our axilla, or our armpit basically, that often are removed or that are affected when a woman is in this position and they're having radiation completed, that can trigger this swelling to occur. And so that is sort of what that is, but how, who, etc. goes into diagnosing this condition. So often lymphedema is a clinical diagnosis, meaning someone will go in to see their provider, either their oncologist or a physical therapist that specializes in this. And we look for a few things. So one is that we can actually measure and calculate the volume of a patient's arm. And so we calculate that in milliliters, and we can use that in comparing one side to another side. And certain criteria can indicate lymphedema is there. And the second is just often the patient's symptoms. So if someone feels that their arm is heavy, that their skin has become more tight, and they are noticing those changes, that often indicates to us what's called stage 0 or even subclinical lymphedema. So we can classify lymphedema from stage 0 up to stage 3, which is when someone has pretty profound changes in their skin. They have what is called fibrosis, which is a hardening of the skin because the fluid has been present and not moving in quite some time. So patients can develop this swelling anywhere from basically the front part of the chest any area in the breast tissue, upper arm, lower arm, and hands. So every patient is different. Some women will develop that just in the fingers, some just in the breast tissue, and some in a variety of multiple places in the arm. So all of those things are what I look for when I'm evaluating a patient and determining whether they have lymphedema. So that is, again, in a nutshell, what lymphedema is. It affects many people. I've kind of touched more specifically so far in this video on breast cancer. Lymphedema can also actually occur in the lower extremity, so in legs. I have seen that in a couple of cases. One is ovarian cancer, testicular cancer, and also often skin cancers that can metastasize and affect lymph nodes, either in our what's called our inguinal crease, sort of around our hips, or somewhere in the legs themselves. So it is not a condition that is just to one area. It can affect anywhere from our head down to our toes. So if you know someone that has had cancer, or you yourself have questions about this condition and what goes into how we evaluate this condition, how we diagnose lymphedema, and some of the things that I assess and look for, please drop a comment, reach out to us, call us. I'm happy to connect and to chat. Stay tuned. This again is one of 3 part series. So part 1 today was what lymphedema is and how we diagnose this condition. And the second part that you can stay tuned for next week is how we go about treating this condition. So please, again, reach out if you have any questions or know someone that has been affected by this, that might need to see or hear this video. And I hope you all have a wonderful rest of your day and a good week. Thank you.